Now, the Nigerian Medical Association in Lagos has raised concerns over what it calls a crisis from a circular which removed medical and dental interns and doctors from the scheme of service. Chairman of the association, Adetunji Adenikon, says the implementation of the circular may put more doctors on the road to live in the country. Sarah Yeko reports.
This is a press briefing heralding the annual general meeting and scientific conference of the Nigerian Medical Association in Lagos. Unfortunately, what is top on the agenda for these medical professionals are issues that could further deplete their ranks. One of such is the removal of medical and dental interns, house officers, and NYSC doctors from the Lagos State Scheme of Service.
They are doctors working under supervision. They are not students. And people say that it forms part of their training. It forms part of their supervision. And by removing them from the scheme of service, you erode on the relativity pattern that exists in the health sector, where the least on the cadre of doctor must be at a particular ratio to the least on the cadre of other health workers.
He noted that this class of workers are essential frontliners in the fight against COVID-19, and any form of maltreatment will demoralize the doctors.
Only Lagos State government hastily commenced its implementation out of all 36 states and FCT, that the Lagos State government will see the need to withdraw the crisis-prone circular released by the head of service of the Lagos State Public Service, communicating the removal of house officers and NYSC medical and dental doctors from the Lagos State Scheme of Service.
Following a communique issued at the end of the National Association of Resident Doctors meeting in Abia State on the 30th of July, resident doctors have already downed tools from the 2nd of August to say they have no other choice.
It's so disheartening that it's at this point where we're talking a lot about brain drain that we're having problems like this, because before you know it, you start thinking, do I need to relocate? All these constant problems with issues of payments of these, issues of conditions of service. If I go abroad, how many times do I hear of strike from doctors? But we hope that the government quickly answers us as soon as possible so that we go back to work. We are interested in working. We are sorry about the situation, but at the same time, this is the way in which the government seems to get that we need our demands to be met.
Rising from the briefing, the Nigerian Medical Association hopes to propose a law that will check any case of medical negligence and prosecute offenders instead of a social media trial of medical and dental practitioners. Sarah Ayiku, TVC News, Lagos.